Well, again, good afternoon, everyone. It's so great to have you with us for a very special edition of the Hunt Institute's Early Efforts webinar series. My name is Dan Worry. I'm the Senior Director of Early Learning for the Institute, and we are glad to be talking about childcare and workforce participation and some important lessons from Ohio today. As we get started, I want to first introduce you to the Hunt Institute's President and CEO, Dr. Javed Siddiqui, to make some opening remarks and introduce some additional very special welcoming remarks from Governor Dewine. Javed?
Thanks, Dan. Good morning to everyone. Thanks for joining us. It's great to have you with a special edition of the Hunt Institute's Early Efforts webinar series, which is being hosted today in partnership with our friends and our great colleagues at the Council for Strong America and Ready Nation. We appreciate your collaboration on this project. As Dan mentioned, my name is Javed Siddiqui. I have the great fortune of serving as the president and the CEO of the Hunt Institute. We are located in Cary, North Carolina. For those of you that may be joining us for the first time, this institute was the creation of our founder and our current board chairman, four-term North Carolina Governor Jim Hunt, to serve as an education policy resource to governors, state lawmakers, and other senior elected and appointed administrative type policymakers. So as we all know, COVID-19 has badly exacerbated the challenges already being faced by the nation's childcare industry, and the lack of affordable, high quality care is now being felt across the American economy and taking a particularly hard toll on women who have been forced to leave the workforce in large numbers. So much so, in fact, that some now have begun taking to calling this not a recession, but a she-session. Our partners at Ready Nation have released an important report on this issue that we'll get to as part of today's panel, which will spotlight lessons learned in the state of Ohio. But if you're not from Ohio, rest assured, this session is very much for you, as these are challenges being faced in all 50 states. In a few moments, I'm going to turn things back over to Dan, who's our great Senior Director of Early Learning at the Institute. But before I let Dan take over the conversation and introduce our panelists, I do want to welcome some remarks from the governor of Ohio, Governor Mike Dewine. Unfortunately, could not be with us in person today due to some scheduling conflicts, but was gracious enough to film a brief opening remarks for us. And with that, I'll turn it over to Governor, and then Dan will take us home.
Hello, I'm Ohio Governor Mike Dewine. Thank you for allowing me the opportunity to address you today, and thank you to the leaders of Ready Nation and the Hunt Institute for bringing attention to the challenges that families and employers face in regard to child care. Access to quality child care is vitally important to Ohio families and to the workforce. Our administration, working closely with the legislature, has made historic investments in children and in their care, but there certainly is more to do. The pandemic placed pressure on the child care infrastructure. When COVID-19 arrived, parents, particularly mothers, left the Ohio workforce to care for their children. The state stepped up to support workers and child care providers during this time, serving thousands of children of workers and providing more than $100 million in additional financial support to child care providers who were impacted by reduced capacity, quarantine, and closure. With the arrival of COVID-19 vaccines, Ohio businesses and child care centers have reopened, and our administration is working hard to ensure that parents have quality options available. Immediately after I was sworn into office, I signed an executive order creating my Children's Initiative, which, among other things, is leading our efforts to raise the quality of child care in Ohio. Child care is essential, not only for children's development, but also to help families get to work and to further their education. That's why my team and I have focused on improving the quality of child care, to ensure our children are ready for kindergarten, and expanding access to child care so more working families can benefit from quality care for their children. We've been really successful on both fronts. When I came into office, less than 40% of child care providers receiving public funds were quality rated. But within a year and a half, every single provider was quality rated. The operating budget I signed in July increased eligibility to serve more low and middle income families. Never before has our workforce been more important. To keep our economy moving forward, we need to make sure families have access to care, both safe and quality care for their children. Let me congratulate the business leaders of Ready Nation and the Hunt Institute for their efforts to highlight these important issues. Meetings such as this are crucial as a means of sharing and learning from others. Your commitment to children and to families will make a positive difference for Ohio's future.
And many thanks to Governor Dewine. How great to begin with those opening comments, and what a great statement of support for the child care industry from the governor as well. We thank him for all of his leadership in Ohio. I am pleased to take the moment to introduce you now to our great panel for the day. Former Congressman Steve Stivers is with us. Congressman Stivers now serves as the president and CEO of the Ohio Chamber of Commerce. Congressman, great to have you with us. Barry Ford is president and CEO of Council for a Strong America. And two Ohio business leaders, Jim Sperlino, Chief Executive Officer of Sperlino Materials, and Danielle Folliott-Monk, who is Chief Operating Officer for Global Healthcare Services. Panelists, it's terrific to have you with us. Thanks for taking time out of your busy schedules to be with us. Congressman, I want to start with you. We heard from the governor, but we know certainly that before the pandemic, roughly a third of parents reported that they were having difficulty finding affordable, quality childcare. And we know that across the country, half of American families report living in what is called a childcare desert. For those who are unfamiliar with that term, what that means is that there are at least 3 children who would be seeking care for every licensed or registered child care slot. So an inequity there of demand versus the availability of child care. And we know that those numbers are on the rise, though we're still lacking some current data during the pandemic. We know that some have had to close as a result of COVID-19. Others have had to reduce capacity, first because of public health requirements limiting the number of children together in a room, and here more recently as a challenge to attract, on the topic of the workforce, attracting folks even into the child care industry. The U.S. Treasury Secretary just 2 weeks ago issued a report and called the current child care system unworkable. So Congressman Stivers, want to just lead with you as the leader of the Ohio Chamber of Commerce. What are you hearing from the business community there in the state regarding the workforce issue, and in particular, as Javed set up in the opening comments, the question of women having to leave the labor force because of this connection to childcare?
Well, thanks, Dan. We are hearing a lot of things, and I've heard from families who have lost their child care during the COVID pandemic as a result of the reduction in capacity. I've heard from people that run healthcare centers. Lois Rosenberry from Toledo is on our board at the Ohio Chamber. She runs daycare centers. She's having a really hard time finding staff and had to continue to keep her capacity reduced as a result of it. And I've heard from families that are having a tough time getting child care, and even leaders in communities. One of my good friends, David Scheffler, is the mayor of Lancaster, Ohio, a medium-sized town on the outskirts of Columbus, Ohio. And they are one of those childcare deserts that you talked about, Dan. And he's been working to try to build capacity in his community, because for him, it's about getting children ready for kindergarten. There's the educational components that are super important. It's not just daycare, it's literally early childhood education. And I want to be clear about that. This is early learning that helps get students kindergarten ready and ready to read and ready for Ohio's 3rd grade reading guarantee. But the workforce situation is especially acute in the childcare industry. And, we've seen people leave their careers in childcare and have a lot of providers have a hard time finding replacements. And it's been a real issue. And frankly, it's keeping some families to be a one household income family because one of the other parents stays home and watches the kids. It's a giant issue in Ohio and nationally, and something we need to care about and pay attention to, because as we think about growing our workforce, we need to start to make sure that there's daycare there so that both parents that want to go to work can actually go to work. You know, Governor Dewine and the legislature have made historic investments in funding quality childcare and have exhibited great leadership in utilizing federal pandemic relief dollars effectively. But I know that there's much more that needs to be done. And I think we have to look at new investments in quality childcare and preschool, ensure that both women and men can effectively return to work. I think that's really key to getting our economy back on track. And, you know, when I was in Congress, one of the things that I worked on a lot across the aisle was Head Start, which is a federally appropriated program to help make sure that people of lower income means have access to early childhood education. But there's a lot more we need to be doing. And frankly, what I'm hearing lately is about people that are, you know, above the poverty line, that are middle class, that, you know, it just doesn't make sense for the wife to go back to work because health or quality childcare costs so much. And we need to do some things to look at what can we do to help those people that are above the line that frankly get no help today. So I think all kids deserve a chance to get off to a good start educationally, and you know, quality early childhood learning is really important. It has evidence-based results that show that it works. And you know, it is a softer issue for folks like the Chamber of Commerce, but it's a really important issue because again, it's about growing our workforce and making sure everybody that wants to go to work doesn't have an impediment to going to work. So, and it's about those kids' educational future and future workforce. So it's a softer issue than taxes and regulation, which are the meat, sort of the meat and potatoes of a Chamber of Commerce. But, you know, it's important to have balance. And it is one of those issues that's important to the 318,000 employers in Ohio, because if they want access to employees, you know, those employees that have kids have to make sure that, you know, they've got a quality place to have their kids get an early education start. I hope that kind of answers the question, Dan.
Absolutely. Well said, Congressman. And it's great again to have you with us. I'm going to turn to Danielle Fayette-Monk here. Danielle, you know, as Congressman Stivers mentioned, expanding access to affordable care is a really vital tool for recruiting and retaining working parents, especially women. Childcare costs families on average more than $9,000 a year. Married couples tend to spend about 10% of their household income on childcare, and single parents average up to around 34%. It is more costly than for many people than rent or a mortgage, and in some states sort of parallel with what they might be paying for in-state college tuition. At a time that that many families starting out and having young kids are not at the peak of their income earning potential. They may be younger adults earlier on in their career. So Danielle, I'm fascinated to know. I mean, you are a recruiter in the medical health field. What are you experiencing right now? What are you hearing both from businesses that are recruiting and from candidates on this topic right now?
Sure. Thank you, Dan. It's a pleasure to be here with you today to talk about this very serious issue. Yeah, hospitals are experiencing workforce shortages that I have not seen in 25 years in my career, largely in part due to COVID and the lack of childcare options for nurses, doctors, and all healthcare staff. Hospitals are 24-hour operations, so there is a lot of non-traditional hours that they need childcare for, and they're just not finding it. And if they can, it's so unaffordable, it makes more sense for them to stay home. I can't tell you how many people, healthcare professionals, nurses, even up to upper level management that I've attempted to recruit, they just can't afford to return to work due to the lack of childcare or childcare availability during their shifts. It's just not economical, or in worst case, it's not even available. I recruited a nurse a few short weeks ago for a local hospital here in Cleveland that's looking for third shift nurses. She did come home after the pandemic hit. She has 3 small children, had worked a full career, 10 years, and wants to re-enter the workforce. And I can't tell you how badly this hospital needs her. We had coordinated an interview, and she called me back 24 hours, short hours later, and said, unfortunately, I'm going to have to cancel. I can't find childcare for all 3 of my kids. And if I could, it would be so unaffordable that it wouldn't make sense for me to leave the house. This is a big issue. We're all consumers of healthcare. At some point in our lives, we're going to be patients of healthcare. Imagine showing up to the emergency room at 3 o'clock in the morning and being told they can't take you because they don't have enough staff. This is actually happening. If we don't fix this problem, it's going to be a crisis for all of us. Prior to COVID, hospitals were actually looking at the idea of investing in the development of on-site childcare centers that would operate 24 hours a day so that they could accommodate all of their staff. And pretty much it was put on hold when COVID hit. If we don't get and take an initiative to get state, federal, and private employer investments to fix this, again, the crisis is just going to continue to get worse. As the state and federal governments begin to rebuild childcare systems, it is so important to ensure childcare programs that serve working parents of all shifts. Night shift is such a huge problem in hospitals, and it's nurses are working as if they're 3 people. And as a patient, you don't want to go into a hospital at 3 o'clock in the morning to a nurse that's working as if she's 4 people. We need to come up with a solution very, very quickly.
Danielle, thank you. And I have to say, I'm enjoying seeing all of the activity in the chat today. Please continue sharing your stories as we go. And I did want to mention that here a little bit later in the hour, we're going to take some time to facilitate some questions from the audience as well. So if you would, please use the Q&A function that is down at the bottom of your Zoom screen. I think given as much conversation as is happening in the chat, those will be difficult for us to find. So do, if you've got a specific question, plug it into the Q&A so that we can make sure that we see it and hopefully get that onto the panel here in the next couple of minutes. Jim Sperlina, let me turn to you. Researchers have estimated that about 10% of childcare across settings is of a very high quality. And among the shortcomings in quality is provider turnover, which, at precisely the age that children need, long-term, stable, caring relationships, we end up having, in some cases, very much the opposite. We have, very high turnover rates. Up to 40% of childcare teachers, for example, are estimated to leave the classroom, and that compensation is often related to their own, or I'm sorry, the turnover is often related to their low compensation in the field. We know that the median salary for childcare workers in the country is $12.25 an hour at this point. So, Danielle spoke to this question a little bit from the perspective of a recruiter that is working with businesses in the healthcare industry to meet those staffing needs. You are directly an employer. So talk a little bit to, what do employers want more quality childcare options post-pandemic? And if so, what sort of systemic changes are going to need to be made to meet those needs?
Sure, thanks, Dan. And there's no question that employers, are suffering because we are just not able to bring employees on board. We have employees that have trouble showing up every day or showing up on time because they have childcare issues. The country right now is employing 5 million less people than we did pre-COVID. And a lot of this is the childcare industry is not recovering. And by the way, before we go any further, I want to reemphasize a point Steve made earlier, that childcare is early learning. And we've all got to embrace that concept. That childcare is not babysitting. Childcare is not dropping the kid off so you can go to work. There's an important component that we've got to make sure we have quality. I've seen in the chat room some comments about what quality means. Is it fair? We can all start to make that a better system. In Ohio, we have Step Up to Quality, a system that we've had for several years now that's working to make sure that we're monitoring quality in our childcare centers and getting what we need for our kids. That's an investment we have to make. As far as being able to have these quality childcare centers for our employees, the biggest difficulty is here in Ohio, as you pointed out, a third of our employees live in childcare deserts. So number one, there simply is not enough slots available. And what we found is the affordability becomes an issue for many of our employees. Not everybody is employing, professionals making hundreds of thousands of dollars. For the most part, you talked about the affordability part. Here in Ohio, it's $10,000. That's equal to a year of public college. And the Department of Treasury came out with a report last week that shows 60% of people using childcare are paying amounts they can't afford, defined as 7% or more of their income. That is a unattainable, unsustainable system of childcare in our country that's affecting our ability to grow and sustain what we all do for a living, what people all would like to do, which is have a job, but have a place where they can send their kids, feel comfortable, that they're safe, but also know that they're getting quality early learning experiences. And for the most part, a lot of states are doing a good job at increasing the availability. Here in Ohio, as the governor pointed out, we increased the availability of childcare slots up to 142% of the poverty level. That's great. We need to make more progress, though. And as an employer, I can tell you that every day I talk to other employers, my suppliers, my customers. We all have the same problem. We've got equipment, we've got trucks, we've got jobs that are going unfilled. And at times you're often talking about systems and plants that are millions of dollars of unused capacity and unused investment. And that's stifling the economy. And by the way, that's also affecting how all of us business leaders look at how much are we going to invest in the future? How much can we invest? And when you talk about childcare centers, yes, some large employers are investing in their own childcare centers. Across the country, the U.S. Chamber of Commerce found only about 1% of employers actually have direct support for an on-site facility or some sort of backup childcare. This is not a supply and demand typical market solution that's going to happen over time. This is something that needs intervention, at the federal and the state level. There are often a lot of possibilities where we can make improvements to existing systems, including child care development block grants, where states are able to use money to invest where they feel it's needed. And of course, every state's different. That gives them the flexibility to address their own problems. We've got child and dependent care tax credits that need to have their caps raised and increase the flexible spending accounts. We've got to be able to help these child care businesses stay in business, get into business, expand to meet the demand that we all are causing by not having folks available to work. And, again, it's one of those things where people want to go to work. It's just that they don't have affordable quality childcare to allow them to take that job. That's a big problem. I think you're on mute, Dan.
All right, yep, good. We'll all figure out the mute button one day here. So Barry, let me turn to you. For many years, there's been conversation, the big conversation in public policy around early childhood has, focused, very strongly on pre-kindergarten for 4-year-olds. But there has been here in recent years, and I think very much now highlighted by the pandemic, a lot of discussion regarding the need for greater investment in childcare to bolster the demand to serve infants and toddlers meaningfully. We know that this, not only has the workforce implications that we've been talking about today, but are really truly critical years in the development of our young children. And some prospect actually on the horizon. I know Congress and the administration right now, are debating the American Families Plan and what the administration has outlined that could dramatically increase both childcare and pre-kindergarten. So curious to know, as president and CEO of Council for a Strong America, what has your organization's perspective on this issue been, and what, if anything, are you doing to help to rally greater support for sustained investments in childcare in particular?
Thank you for that, Dan, and thank you for including me in this important conversation in this panel. Look, Council for Stroke America has long been committed to advocating and moving forward investments in early care and education. Both Congressman and Ms. Perlino are right that this is not babysitting. This is about developmentally appropriate experiences for very young children so that they can achieve their potential and realize the full success as adults. But we as a country have not prioritized this. We have put the burden of finding quality care on the backs of families and on parents, and for too long. They shoulder too much of the cost because that's where the resources to support these small businesses is coming from. The child care providers have incredibly thin margins, and so there isn't enough supply. And again, because they don't have the resources they need, they're not able to pay their workforce enough to stem the turnover crisis and to encourage quality and sustainability of their systems. This is a long-time problem. Ready Nation produced a report that in many ways enabled us to change the conversation around this issue before the pandemic. We released it in 2019, and we found through dedicated research that the absence of high quality childcare for infants and toddlers, kids from 0 to 3, cost the American economy $57 billion a year. In Ohio, it's $1.7 billion. Now, you look at that kind of cost, that kind of failure, and you say to yourself, what needs to happen and how do we need to fix this? Because no one would say that an annual loss like that year over year is something this country should tolerate. That's just the economic impact. Think about the human impact. Think about the impact on the lives of those young children who are not in quality care, who can't be in quality care because their parents have to go to work, but they have to find some place to put their kids. All right, so what are we asking for? The federal government needs to become a bigger partner. No, this is not something that families, businesses, states, as great as Ohio has been, they can't do it alone. The federal government has become a much more substantial partner in making this work and making this business model work. It needs to be heavily subsidized. So we're calling for direct grants to providers, increase direct payments to stabilize the industry and to grow the number of providers available to help address, you won't completely fix it, but help address the existence of childcare deserts throughout the country. By the way, you say 50% of Americans live in childcare deserts. That's right. In rural communities, it's 60% live in childcare deserts. It's even worse. So we have to do that. That kind of direct payment to providers will also enable them to increase wages to childcare workers. We need to have people who take care of our kids make a living wage. What that means is currently, you decided the figure, Dan, but a third of that workforce depends on public assistance to make ends meet for their family. They go to work every day. They take care of the most important thing in our society, and they are dependent on public assistance to make ends meet for their own family. That's a tragedy. That's wrong. So that needs to be a living wage. And the final thing we need to do is what Danielle mentioned. It's like we need to have a system that is multi-platformed, multi-delivery systems, right, that enable families who have unusual or non-traditional work hours to get the care they need. And that means leaning into the diversity of the system. We have, just as an example, we have a system where 97% of the venues where kids are taken care of are home-based. 65% of the kids that are in care are in home-based care. So we need a system and resources that enable that to grow and to be of quality and to be supported. And we need laws around that to make that happen. And so that's part of what is currently on the table at the federal level. It's currently being discussed. But in addition to that, we need to increase the subsidies for CCDBG, which as Jim mentioned, the Child Care Development Block Grant, it helps support the childcare needs of particularly low-income folks. For middle-class people, we need to expand the tax credit, the Child Dependent Care Tax Credit, to help them pay for this. We need to deal with the affordability issue. Small childcare providers are small businesses. We need the federal government using the Small Business Administration to help support them as small businesses, help them use those new resources in a way that maximizes their effectiveness. And then finally, we need to make it easier for those employers that really want to support their employees to provide either on-site or near-site childcare center or some other kinds of supports for their employees as they look for quality childcare for their kids. I want to end with this. The pandemic turned a crisis into a catastrophe. So the system was already not operating optimally, right? So what the pandemic did is it basically said, look, it exposed the childcare industry as foundational to every other industry in the economy. Look, it's a 60 billion, this is an estimate by the Treasury Department, so it's probably understates it, but it's a $60 billion part of our economy that is foundational to everything else in our economy. So we need to make sure that we effectively meet it. And the way to do that, to my mind, is, and frankly, to all of the organizations that are under Council for a Strong America, including Ready Nation, is strong federal support around all the issues I've outlined, deep partnership with states like Ohio that are doing amazing things at the state level, and supports for the private sector to do what they can do to make this work.
Barry, thank you. And everyone, continue please plugging your questions into the Q&A. We're going to shift to those here in just a minute. But Congressman, I'm going to wind up for the pitch here and tell you there's a question coming for you. But I wanted to just pause and appreciate, Jim, how much how great it was to hear from a voice other than myself or those working in early childhood policy, the recognition that childcare is about early education. That we know better than we ever have that young children are learning from birth, and frankly, there's even some evidence that the children start recognizing the voices of their mothers and language patterns even in utero. So we know that children are learning right from the beginning, and so it's so important that we recognize that all environments where we find young children are learning environments. There may be better and worse environments for that learning, but there really is no such thing as daycare, as I think we once sort of conceptualized, just a place that children are safe during the day. All environments are learning environments, and in the context of this discussion, it's so interesting when we talk about childcare and the workforce. There are so many different aspects of the workforce, right? So we've talked a good bit already about the impact of the availability of high quality childcare for the American workforce generally, for parents to be able to participate in the labor force. We've talked a little bit about the childcare workforce itself, and Barry citing those, the low wages and their participation in public assistance. But Congressman, I wanted to ask you about maybe the third part of that, which is the future workforce, right? When we talk about childcare's impact on the workforce, we talk about the workforce of today, the parents who are participating in the labor force, but also the workforce of tomorrow. And I'm sure that as you are thinking about these children that are participating in care now, your members at the Ohio Chamber have got to be thinking about their needs sort of, in this increasingly global high-tech economy, what their needs in terms of future employees are going to be. So talk a little bit about what you're hearing from business leaders in Ohio about how early childhood might support the workforce of the future there in the state.
Well, thanks, Dan. And let me start by saying the number one thing I hear from every employer right now is a complaint about access to workforce. They're having a hard time getting employees. They're having a hard time getting employees that can do simple things like pass a drug test, show up on time, put in 8 hours, come back the next day. Those kind of soft skills show up in the right uniform or dress, and then the hard skills of math and the specific job that they might have, being able to talk to a customer, some pretty basic but very important things that our K through 12 system and our higher education system need to instill in our workforce. But if somebody's not ready for kindergarten and they show up when they're 5 years old and they're already a year behind or more, they're not going to be ready to read by 3rd grade. They're not going to be ready to, if they can't read by 3rd grade, they're going to have a hard time with the middle school and high school curriculum, and they're going to be behind their entire life. And by the time they turn 18, if they're going directly into the workforce, they also likely will have some other social issues and other hard skill, soft skill issues of showing up on time, those kind of things. So it's even in early childhood education, the things we read and learn. My mom was a kindergarten teacher, and one of the things she instilled in me is all the important things we learned, we really did learn in kindergarten: how to work together to get things done, how to actually communicate your own needs, how to understand group dynamics, how to get along with people. Those things really matter, and we don't just learn them in kindergarten, we learn them in early childhood education, and they start when you're younger than a toddler, an infant, and then all the way through early education through the K through 12 system. So the pipeline for employees is super long when you start looking at early childhood education, and I can't tell you what the workforce 17 years from now is exactly going to need in hard skills, but I can tell you the soft skills of being able to communicate, being literate, being able to show up on time, being able to pass a drug test, being able to get along with people at work. Those things are things that start in early childhood education, Dan.
Well said. Thank you, Congressman. Jim and Danielle, I want to turn to a question that I think may be appropriate that both of you weigh in on. Christina, who is in Northern Kentucky, Cincinnati area, is asking, what do you think needs to happen to get companies to consider childcare as a priority benefit for employees? For example, what might be done to encourage companies maybe to start looking at partnerships with nearby childcare providers, or even creating on-site provision as needed?
I'm happy to start. I just think they need to realize that there's a need for it. And as Steve said, it's worse than ever trying to get people to come to work on a daily basis. And if employers just had that leg up, I think they would thrive. So again, I think it's making them realize that, or just accepting that this need exists, and realizing it's an easy solution. If a parent is struggling to figure out how to get to work on a given day because, let's say, a babysitter doesn't show up, or they couldn't get into childcare, or they can't afford it, imagine just being able to leave for work on that day and take your child right there with you. It allows young mothers to take their children to a place that's right next door to where they have access to that young child, to where they can still breastfeed and have interaction. As you mentioned, it's so important that kids have early childhood development. And that's what we're seeing. The hospitals that I work with that actually do this, they don't have staffing shortages like the others, because if they have that available, employees look at that as a huge perk. So I think if more employers could see that and realize the success other employers are having by offering this, that all of them would realize this is something that they need to do. They can't afford not to do it.
Dan, I would just add, and I just want to kind of come back to what the reality of the situation is with a lot of small businesses. And, about half our country is employed by small businesses. And I can tell you my own business, while we've at times had, as many as 300 employees, they're scattered across 10 sites. And so these are not, I'm a pretty typical medium-sized employer. I really don't have a high density in one location. And I'm not saying that the businesses shouldn't get creative, but I think it's difficult to expect individual businesses to be able to come up with a solution that really is a structural solution. And a lot of things that I talked about and Barry talked about that the federal government and dollars flowing into the state government really have to solve is where we need to concentrate on. I agree businesses should be creative, think about how to partnership, talk to their chambers of commerce or their roundtables, and see if they can aggregate a number of employers together to create a solution. But the individual employers, this is really how this problem has gotten created, is that there's a huge number of employers with not a lot of employees, but still a significant percentage of employees that have childcare issues or empty slots, employees they haven't hired that they're waiting for those childcare issues to get resolved. It's a structural problem. It's not, like I said, a free market problem that's going to get resolved by businesses getting more creative or offering more money. It's something that we need this foundational support to put a sustainable system of childcare in place for this country.
Jim, thank you. Barry, I want to come to you with a question. Tammy is asking in the chat about the challenges being faced, in particular by smaller communities and rural communities. I know, you mentioned that in rural communities, upward of 60% of those communities are childcare deserts. Tammy's asking, are there specific things that can be done in those communities at the local level to support working families and childcare providers? I can't help but think that maybe family childcare is a big part of the solution there.
That's absolutely true. I mean, family childcare homes are. It's going to be it's what people rely on in most rural communities, and I think it's going to be infrastructure that needs to be built out. But the issues with that are providers, even very small ones, need help because they can't just depend on parental fees to pay for the workforce they need to provide the care that they're providing in their homes. They need to have the supports around subsidies. They need to have the supports around training and education. They know if you're running a family childcare home by yourself, you're on your own. So you need to have a network of supports, and they exist. They exist all over the country. What I would say is there needs to be a greater intentionality at the state level, at the federal level, to help make those networks stronger and more responsive to the needs of providers in rural communities. The fundamental problem of a rural community, though, is the challenge of scale, right? You're scattered, it's small. So it's depending, I think, on regional networks that do exist, but need to be more robustly invested in to help support childcare providers in those spaces.
Barry, thank you. Congressman Ike, I feel like we would miss we'd miss an opportunity not to have you weigh in on the politics of the situation as well. We've talked about the impact on the business community. We know that there are proposals that are in front of Congress literally right at this moment that are being discussed. Is this an issue that you think that we can find bipartisan consensus in Congress to move some of these proposals forward?
Great question, Dan. And we've always been able to find great bipartisan support in the past for important things in education, important things like Head Start. So I'm hopeful that there will be a bipartisan agreement and solution that people can get their hands around. And though it may involve some paring back from original proposals, but any additional money is better than no additional money. And I think there is real value to a bipartisan approach. And I hope that Republicans and Democrats can work together, because it's a giant issue that is keeping some people from getting involved in the workforce. And it's an issue that's keeping some kids from being ready for kindergarten. So it is an important issue that I hope we can bring bipartisan support around, because it's one that matters. Doesn't matter whether you're a Republican or a Democrat, whether you're from an urban area or a rural area that might have a childcare desert. We need everybody to have real access.
Thank you. Question, I'll throw this out sort of broadly to the panel question in the chat, and with the caveat that Jim made the important point that it may not be realistic to expect that employers are going to take this issue on in isolation from broader, more structural support. But a question asking here, are there tools to guide employers to do a cost-benefit analysis of providing family-friendly benefits such as childcare fee assistance or on-site childcare? Barry, I don't know if that's something maybe that you have run across in your work. Are there resources that you're familiar with that would help employers think through the benefits here?
This part I don't know as well. I believe that a number of states have, through associations, talked with employers about what they can do and how they can go about, as Jim suggested, collaborating to create systems to figure out how they can go about supporting their workforces. I will say this though about that question, because I understand that it is an important piece of this ecosystem, but I don't think we should be leaning on that part of the ecosystem at this moment. The problem is too big, right? And the scale is too big. And the only players here that can deal with the scale initially, I think, is the federal government, and then in partnership with state governments. It needs, whatever the federal government does needs to have the flexibility so that states, because states have different issues, different communities, states have to be in a position to be able to adapt federal resources to the urgent needs of their states and communities. So that's why I know I'm sort of punting on the core question, but I'm doing that because I just think the node that we need to be pushing hardest on is where there's the greatest likely impact on the entire system.
And Barry, I'll throw out, there's a similar sort of, not the question in the chat here about recognizing that parents also pay a lot into this system. I'm guessing that your response would be that, like businesses, the parents are not where we need to be pushing on balancing out the stool.
Yes, absolutely. I mean, in fact, I would argue parents have been carrying this burden for generations. Parents have been doing this on their own for a long time. It's now time for we as a society to support parents and families as they try to make this work. Let me say one more thing. I think that one of the reasons I'm leaning so heavily on greater public investment, and my organization is pushing so hard for these public investments, is that the benefit to society is huge, one, and the benefit to the current workforce and the future workforce, as both Congressman Stivers and Jim Sperlino said, is just huge. It's some studies have found that the return on high quality early care and education is 9-to-1. So even if it's not that high, I mean, there may be skeptics out there. Even if it's not 9-to-1, imagine if it's just half of that. Isn't that worth it? So my point is, we need to figure out how we can, to the extent possible, increase the scale and the availability of high quality childcare wherever kids and families need it. And that would be everywhere in our country.
Absolutely. Great question in the chat. Nancy is noting that we've thrown out some figures about childcare deserts and asking, are those figures current or pre-COVID? Because she's fearful that the problem is much worse now. I think, Nancy, we definitely, I do believe those figures are pre-COVID. For one, I think we're still like so much of the data on childcare right now, sort of still in the process of getting a handle on what the impact of the pandemic has been. We have providers that have closed temporarily. We have providers that have closed permanently, and then we have providers that I think we're still in sort of a wait and see mode. But no question, at least anecdotally, that we are seeing childcare deserts across the country. Both existing deserts become more barren, if you will, but likely new childcare deserts, springing up in the process of losing so much capacity here during the pandemic. Got just a couple of more questions. Danielle, wanted to ask you. You're working with lots of healthcare employers. What are they thinking now? Are you hearing anything about them adding in childcare benefits as part of a package to better attract the workforce?
We are certainly urging them to. Nurses and other healthcare staff are offered large sign-on bonuses that are taxed at high dollars. So yes, we have encouraged them to please look at this as an option. It makes so much more sense, and it's a win-win for everybody. So yes, those discussions, and to be honest, it's the first time I've seen it because the need is so great. So yes, those discussions are starting, and I'm part of those discussions, and I'm going to continue to push and push, and hopefully we can create that. Because as Jim was saying, some of these institutions, they are small. I work with rural critical access hospitals that have 9 beds in their hospitals. They're never going to be able to build a facility on site. So yes, and to Barry's point, a lot of them in these rural locations, they're in homes. So yes, if there was some sort of a bonus or a voucher program for these people to be able to use it directly for childcare, I think that would be a huge part of the solution. So absolutely.
And Barry, I don't want to put words in your mouth, but to this question of the challenge of employers creating their own childcare programs, certainly that has to be considered on a case-by-case sort of basis.
Sure.
It may be in rural communities that's absolutely the best solution. But is there merit in employers maybe not looking into creating their own programs, but instead trying to support the childcare infrastructure that exists and is struggling now?
I see Congressman Stivers with his hand up, but so let me just say this. I think the only problem with the voucher or the bonus payment, it's a useful and helpful thing, don't get me wrong. It helps address affordability. It doesn't do anything on the supply side. You still have the problem of not having providers who are in place to take care of a child, which is why you need other supports. I would say do both things, right? You need other supports, and typically public supports, to help people start that home business in that rural community, so that the new employee can send their child there. You need both.
And if I can add to that a little bit, yes, we've had people not move to certain locations because of the quality of what is available there. We had one hospital that said, oh, sure, there's a local lady that has like 25 kids in her home. Well, you tell that to most people, they are not sending their child into a home where one person is taking care of 25 children. Unrealistic. And it is extremely, almost impossible to staff some of these hospitals unless they are moving another family member with them that can watch their children.
Congressman, weigh in.
Well, thanks. I appreciate the opportunity to weigh in on this. A couple things I wanted to say from the Chamber of Commerce standpoint. One thing that I would recommend every business do immediately is provide flexible spending account opportunities for their employees, because allowing pre-tax dollars to be used for childcare, even at the lowest tax rate, leverages about an extra 20% on every childcare dollar from the employee standpoint. And that's a big deal. And we're working with our 8,000 members to help make it easy for everybody to offer a flexible spending account for their employees. That is something that every business today could and should do to help support this problem. And I will tell you, the more money that comes in to the system like that, even leveraging private dollars by 20% like that, would actually build capacity, because, you know, when you fund it, they will come. And just simple things like that are a big, big deal toward moving us forward. And it's something that not every business offers for their employees. And frankly, not every employee that is offered the opportunity to set up a flexible spending account does it. Now, should we make some changes at the federal level to allow those dollars to roll over year to year? I believe we should, but that would make the acceptance rate even higher. But at the same time, if you can do something that leverages your dollars, again, even at the lowest tax rates by about 20%, why would everybody not be doing it today?
We are getting dangerously close to the top of the hour. I want to give each of you a chance just to make a quick final comment, if you would. Maybe weigh in. What's one thing as we look at the coming year and where Congress is headed, where we're headed in terms of hopefully emerging from this public health crisis. What's something that you'd like to see happen in the coming year to help alleviate this problem? Jim, can we start with you?
Sure, Dan. If I can channel my inner politician, I'm going to answer kind of your question, but answer the question in my mind that was aimed that way. I would encourage everybody to advocate for improving our child care funding at the federal and state level. You cannot say enough about voices rising up, talking to our elected officials, particularly as a businessman. I'm talking to you other businessmen and everybody that's listening in. Talk to your businessmen friends and talk to your elected officials and make sure they know how big a problem this is. Make sure they understand that this is not going to get solved, as we've discussed for an hour now. It's not going to get solved by supply and demand, free market type elements. This is going to get solved structurally by the government, federal and state, helping start this solution. The free market will take over and we'll solve it, but we've got to get out there and be better advocates. We got to be clearer with our message and forceful with our message. And Congressman Stivers knows this. You got to hold your elected officials accountable. Make sure they know what we're looking for, and make sure that they understand that this is important to all of us. And hopefully they'll get the message. Thanks.
Danielle?
Well, not to sound redundant, but that was going to be along the line of my answer. I think people need to communicate. It needs to be told to our elected officials that this is actually a problem and becoming a crisis. If they hear that, they will start to take it seriously. If we just continue to sit back and say, well, it's an issue, and parents complain and say they can't go back to work, but don't do anything about it, it's going to be swept under the rug. So yes, we need to talk to our elected officials, write letters, write emails, and just have a voice. All parents need a voice. And as you were talking about women more so than any, I have so many friends that haven't returned to the workforce because of this. And it's sad. These are highly qualified people that need to be able to go back to work. So yes, they need to start to be very loud.
Congressman Stivers?
I think they both hit on it. I think talk to your elected officials. I will say Groundwork Ohio put out a study last year, a very respected organization in the early childhood learning space in Ohio, that says the return on investment for investments in early childhood education are about 10%. 10% return on investment's great. Maybe not the 9-to-1 that Barry talked about, but even 10% is a solid return on this investment. And I think we need to recognize that there is a real return on investment, and talk to your elected officials. And if you make it a priority, they'll make it a priority.
Congressman, thank you. And Barry, I'm going to give you the final word with the introduction that, I just want to echo what Javed had to say at the beginning of the session. We pulled this session together today in partnership with Council for a Strong America, with Ready Nation, and in particular with Ready Nation Ohio. We are so grateful for your partnership and pulling together this great conversation. Look forward to much more partnership between us. What parting words would you share with the group?
Sure. First of all, I want to thank you, Dan, and the Hunt Institute for the forum and the venue. I want to thank my other panelists for their thoughtful comments and their participation in this event. I think I signed on to, I co-signed everything that was said about what people need to do with regard to interacting with elected officials at the federal and state level. But I would say there's one thing I would add. I think as policymakers think through the choices that they're making, as whether it's in Congress or in state houses, I want them to keep in mind, and one way of doing that is for people to be engaged in this conversation, but I want them to keep in mind the needs of families and the focus of children, because none of these solutions should result in a system that is one size fits all. It needs to be a mixed delivery system that enables families to have options for what they need given their current circumstances and the needs of their children. Critical. That needs to be foundational in how we think about the development of this policy and how we push it forward. And the way that gets into a policymaker's head is everyone needs to talk to them. So we need to organize and mobilize and get in their faces and tell them what people need so they can actually consider this and take it seriously.
Gary, thank you. And thanks to our entire panel, former Congressman Steve Stivers, President and CEO of the Ohio Chamber of Commerce. Congressman, thank you for being with us. Danielle Folliott-Monk, Chief Operating Officer at Global Healthcare Services. Danielle, thank you. Dan. And Jim Sperlino, Chief Executive Officer of Sperlino Materials. It's been a treat to talk to all of you. Thank you for your commitment and your time today. Want to wrap us up by just putting in one quick plug to let you know that our regularly scheduled Early Efforts series will be back on Tuesday, October 5th. We are going to be talking about Head Start and how states and Head Start can work together in coordination. You may know that Head Start is a direct federal to local funding stream that bypasses state systems, at least from a funding perspective. So a great need for states and Head Start providers to think through how they are working together and coordinating. And I'm excited to tell you that just have confirmed today that Bernadine Futrell, who is the director of the Federal Office of Head Start, will be joining us for that conversation. That will be on Tuesday, October 5th at 2 p.m. Eastern. You can register from the Hunt Institute's website or keep an eye out on our social media accounts for registration information. We would love to see you next Tuesday. And again, panelists, thank you for being with us. Thanks to Ready Nation Ohio, and the Council for Strong America for a great partnership on this. And we will talk to you all soon.
Thank you.
Thanks, everyone.
Thank you.